Hello, this is Dr. Sudarshan Ray, bringing to you another in the series of my psycho-educative videos. These are meant for the common masses to raise awareness on mental health issues, and so that mental health issues are perceived as just another health issue, not anything that should be basically, segmented, segregated, and patients with mental health problems are just like patients having problems with the GI tract, stomach upset, and this cough and cold, etc. So this is the aim of this psychoeducative videos. Now today I'm going to talk about the digital cocaine part 2. Now in my part 1 video, I've mentioned to you the concept of this digital cocaine, how this digital cocaine, the screen affective disorder, which actually which are affecting mental health. People are getting addicted. This is a sort of behavioral addiction, getting addicted to this digital gadgets, these mobile phones, the laptops, then the smartphones, the tablets, etc. And obviously now communication has gone up by leaps and bounds, and these have the beneficial aspects also. So today we are going to talk about the beneficial aspects of digital cocaine, or these smart gadgets. You see, the quality time which we are spending. Let's talk about the quality screen time. The quality time we are actually giving on screen to these on screen gadgets. Now these on screen gadgets, they have been used for various educative purposes, for office purposes, for productive work, and this actually has increased manifold during this COVID-19 lockdown period. And you see, we have done office work, we have done our this educative videos and etc. And the children, they have actually attended to the online classes. Even the medical students have attended to the online classes, and our conferences dealing with the various education, the continuing medical education, and we have been benefited. We have been benefited by the educative videos or the online sessions which have been carried out by speakers, eminent speakers from abroad, all around the world. So we have actually provided a time to the screen, and these are the quality screen time. The quality screen time which have actually benefited us and the human population, and they have contributed to the advancement of education, to the advancement of awareness. Even these psychoeducative videos which I am airing, they also form part of this quality screen time which we are investing in. Basically, I'll call this an investment of knowledge, of this education, and about social awareness, obviously, and this helps. This has actually helped. So I mean, not everything about this screen time is bad. Now, as I said, that there are lots of beneficial aspects to this screen time, and when anything, it is something good. So anything in excess, anything good in excess is also bad. You can see it's written in many substances of abuse, like alcohol, like anything you enjoy in moderation. The problem is that when people do not enjoy in moderation, they use excess. So anything excess of good is bad, and this is what happens when actually you provide too much attention to the screen. And it has been seen that the persons who are affected by this the screen disorders, which is a behavioral disorders, have been investing too much time on the screen, and obviously the things which they are seeing on screen, which they are engaging themselves, are not something which are beneficial per se, like playing games and this chatting, etc. This socializing, excess of socializing, this actually has not helped them. And when they are investing their time, they are actually basically they have stopped the interaction with the normal persons, the normal interaction which we carry out, that has been stopped. And obviously this has affected them to a very large extent. Okay, so this has given rise to behavioral aberrations, changes, and they have actually stopped to a great extent interacting with the normal persons, these offline interactions, even when COVID restrictions have been eased to a very large extent. They stop interacting. And obviously when they are interacting on screen, now artificial intelligence they are developing to a very great extent also, but you see, they cannot satisfy your emotional hunger. So where are we heading towards? We are actually heading towards stereotypy. And obviously the screen affective disorders are something which has given rise to this stereotypy, and people are actually asking for novelty seeking behaviors. And this novelty seeking behavior actually has led them to navigate things on screen which are perhaps should not be allowed by the civilized society, certain immoral things there, because even seeing films which are adult in nature and which should be viewed in private, even that does not seem to excite them anymore, and they navigated onto things, onto seeing films which are banned even for private viewing. So these are the behavioral aberrations which the screen affective disorders have given rise to. It's certainly a screen affective disorders. This also is a novelty seeking behavior. Just like the substance use disorders, I mean, people have been seeking novelty in substance use and giving rise to various substance use disorders which should not be allowed in a civilized society. Is not allowed by law. So similarly in the case of these behavioral disorders. And so what we discussed today is quality screen time. So not anything of everything on screen is bad. Okay, but it depends on how you are actually utilizing your screen time, your discretion, the choice of topics. So you see, as I said, that in psychiatric disorders, the patients, my take is that the patients will cure themselves. Now, if the patients have to cure themselves, they have to use their own discretions. I mean, they should not be overly dependent on the psychiatrist or the psychologist to solve their problems, which they're not supposed to. We are not supposed to be opinionated. We're not supposed to be judgmental. And we are not supposed to be giving advices or solutions per se. So we can just provide the guidelines, and the patients will have to implement them in their own daily routine. And that's the way basically the patients will cure themselves. And if the patients decide not to cure themselves, then no amount of coaxing, cajoling by the psychiatrist, the psychologist, the psychotropic drugs, the best of the indoor and the outdoor treatments can cure them. And this digital addiction, this digital cocaine, these screen affective disorders basically are mostly defined by the patient's discretion, their choice, and the quality of screen time they actually spend. So if they're spending quality time on screen and having healthy interactions offline also, then this digitalization is something which the original aim of digitalization of artificial intelligence is for the progress of the human civilization, for the treatment of all disorders including mental health disorders. They will achieve their desired objectives. So till the next video on digital cocaine, on substance affective disorders, the screen affective disorders come in, is bye from my end. If you do like my YouTube channel, do subscribe, like, comment and share, so that you, being the messenger, will help in raising awareness on mental health issues, and consider it as just another health issues per se and nothing to be actually castigated. Okay, so till the next video comes, is bye from my end.